Well, good morning, everyone, and welcome to the latest iteration of our thematics series of webinars. Today, we're going to be talking about digital healthcare and how technology can solve the looming health crisis in global healthcare funding. We'll specifically touch on the new ETF EDOC listed on the ASX, but I think we really wanted to have a conversation about the issues at hand and run you through where we see the market going for this. My name's Blair Modica. I've been with BetaShares for around 5 years. And just before we get started, I just wanted to run through a couple of points of information. First of all, this bit of housekeeping, all information in the presentation is general in nature and doesn't constitute any personal financial advice. And before we kick off, as always, a recording of the session and the slides will be sent to you this afternoon. We've left lots of time at the end for questions, so please use the toggle, type in your question at any stage, and we'll endeavour to get through as many as we can. And if we don't reach them all, more than happy to answer them outside of the session. The other thing I wanted to mention is we have our final thematic webinar game, which focuses on gaming and esports next Thursday at 11 AM. So please keep in mind if you do want to sign up for that. We'd love to have you there for the final iteration of our webinar series on thematic funds. Joining me today, Cameron Gleeson, who sits across our distribution team, really assisting clients with portfolio allocation across different asset classes, and also working closely with the portfolio management team and in new product development. So he's been at BetaShares for over 2 years now, has 20 years experience in the financial markets space, but is also very keen on discussing digital health and has had a lot to do with bringing this portfolio of securities to market. Welcome, Cameron. And thanks, I might Blair. Just kick off today with a question for you, if that's okay. What are the challenges facing healthcare systems across the globe?
Yeah, look, I mean, it's really interesting in terms of looking at the long-term picture. And, you know, Blair mentioned that the funding challenge, look, as populations age and as income levels rise globally, we see that global healthcare cost is in fact increasing faster than GDP growth. And that aging population cuts both ways. It firstly means we need more healthcare services, but it also means that our working age populations are shrinking. So the tax base, which is required to fund healthcare, is also shrinking. And so from a long-term perspective, the funding side of things is really not sustainable. This is a pattern which is playing out across developed market countries. It's particularly acute in the US, as I'm sure many people will be aware of the challenges in healthcare there. The US spends total $4.1 trillion per annum on healthcare, which is 20%, roughly 20% of total US GDP, which is an incredible figure. I mean, to put it into perspective that I think is quite easy to sort of associate with, they spend $12,500 per person per annum on healthcare. And unfortunately, part of this cost is somewhat self-inflicted. Our lifestyle choices and diets have led to extreme growth in chronic illnesses. So we're talking about heart disease, cancer, chronic asthma, diabetes, and chronic illnesses in the States are responsible for more than 80% of all hospital care admissions. And hospital care is the highest cost form of healthcare. In the emerging markets, the total spend as a percentage of economic activities is much smaller than developed markets, but rising or growing at twice the rate. And that's because we've seen these populations really shift from traditional diets, traditional lifestyles to a Western lifestyle in a very rapid space of time. So chronic illnesses are growing at extreme rates there. Take, for example, Pakistan, where 31% of the adult population suffers from diabetes, which is a terrible outcome. Further to that, we've got a lot of waste in healthcare systems, inefficiencies. If you look at the US system, it's estimated about a quarter of US healthcare spending is wasted through either misdiagnosis, poor treatment, or just in fact a lack of coordination in that system. In Australia, it's estimated or deemed that 1 in 5 visits to an emergency department are either unnecessary or really inappropriate, and that draws resources, high cost resources in ER departments, physicians and doctors, places strain on the whole system. So we've got a situation where the care model is inefficient. It's not leading to better health outcomes. We're getting sicker. And, you know, we see that the funding perspective, this is not really sustainable in the long term. So really, you know, sort of kind of dire from a long-term perspective. But there is some good news. Blair, why don't you talk us through how technology and how data is being used to solve some of these challenges?
Yeah, thanks, Cam. Look, I think you brought up some really interesting statistics on that last slide. And in particular, you spoke about 133 million Americans having at least one chronic disease, and that's rising really fast. But also hospital care is 1/3 of total US healthcare spending, and around 80% of hospital admissions are tied to chronic illnesses. So really, we need to harness data to reduce the strain on global hospital and healthcare systems. And healthcare consumers typically interact with the healthcare system only when they're sick or injured. But the future of health will absolutely be focused on well-being and prevention rather than treatment. And I think that's where data really comes into play. Many medtech companies are already beginning to incorporate always-on biosensors and software into devices that can generate, gather, and share data. And we've also got advanced cognitive technologies that are being developed or could be developed to analyze a significantly large set of parameters and create personalized insights into a consumer's health or a patient's health. So the availability of data and personalized AI can enable precision well-being and real-time micro interventions that really allow us to get ahead of sickness and far ahead of catastrophic disease, like heart attacks and things like that. So we've seen various healthcare providers tap into data feeds to see how active we are. And this is definitely going to be set to continue as more of our health information becomes digitized. Insurers will offer and do offer incentives to remain active whilst they're gathering information on how active their customer base is. In turn, this will be able to provide vital information to healthcare premiums. In turn, fitness and nutrition businesses will be able to monitor customers in real time, giving them, but also their customers, accurate information on their underlying health and well-being. So enabling better nutrition plans, preventable nutrition, and fitness issues from getting to the point where in-person care is needed. And if we take that a step further, fitness issues from getting to the point where in-person care is needed, but taking that a step further, real-time monitors on vital organs and healthcare indicators, which will allow people to address potentially fatal illnesses before they require life-saving surgery, or indeed if they've already happened, reducing the strain on the healthcare system. But it also goes beyond that as well. So by being able to access people's individual data, we're able to digitize the financial aspect of health quickly, allowing patients access to benefits quicker and speeding up the financial benefits system, which in turn is going to lower the burden on people who may need healthcare the most. So Cam, if you wanted to just touch on the ETF very briefly.
Yeah, thanks, Blair. So look, I mean, I think this is the BetaShares Digital Health and Telemedicine ETF that we launched a couple of months ago. The ticker code for that is EDOC. And I think it's useful to think about this ecosystem and what companies are actually doing through the lens of the index, which this ETF tracks, which is the NASDAQ CTA Global Digital Health Index. So it's 50 of the world's leading companies that have digital healthcare solutions. But if we just go to the next slide, we show the different segments within this space. The largest segment within digital healthcare is telehealth. So the provision of virtualized healthcare over the internet rather than in a sort of in-office or in-hospital scenario. The next two segments, and maybe I'll come back to these, but I think very exciting, medical devices and wearables. And the other two segments we show there on screen are software. So we're talking about the healthcare software, specific healthcare software, which is designed around data analytics, data management, and using AI for better outcomes and alike. And finally, remote patient monitoring. So these are devices or connected platforms that provide real-time data to remote care providers. So you get that, if you like, that intervention at that critical phase rather than waiting for someone to realize they're sick and visit a doctor. So look, I mean, they're the segments. Blair, I know worth touching on some of the names, some of the well-known names that are in this space.
Yeah, happy to, Cam. And I know you're passionate about some of these in the space. I'll get you to touch on a couple too. But Teledoc considers itself to be the global leader in whole person virtual care. So they provide virtual healthcare solutions on a global basis in primarily the B2B or business to business segment. However, they also do some direct to consumer in the mental health market, which is really just exploding in terms of usage. So they have 76 million members across 12,000 clients, including employers, health plans, health systems, hospitals, and individuals. And that really comes under the telehealth portion of the portfolio. Health Catalyst is another business. It went public in July 2019, so a relatively new business to the public space, offering data or a data warehouse and analytics platform aimed at helping health systems improve clinical, financial, and operational performance. So Health Catalyst has the goal of driving more digital into healthcare. In addition, they offer professional services, including implementation, training, ongoing data engineering services, and access to subject matter experts. So that, again, is a software component of the portfolio. Another software component, Doximity, is an interesting one. It's like a version of LinkedIn, but for doctors. So an online professional network for physicians and other healthcare professionals that generates revenue through advertising by pharmaceutical manufacturers and health systems, as well as through its medical staffing and telehealth offerings. So another company that's really generating a lot of usage within the network. Cam, any others you wanted to mention?
Yeah, so quickly on the medical devices and wearable space, I mean, this is where we see, that growth in chronic illness. Really, if you look, while very unfortunate, obviously providing very strong tailwinds for particular companies that operate in that space. For example, Dexcom provide wearable devices for people to manage their diabetes. I mean, I talked about the prevalence of diabetes, particularly the growth of that in the emerging market, but also if you look at that example of Pakistan, that estimated 31% of people with diabetes, a quarter of that sample size, they're undiagnosed. They don't realize they've got diabetes. So, we're going to see, increased rates of adoption of wearables to manage these chronic illnesses. ResMed, you'll all be aware of that company, I'm sure, but they have sleep apnea solutions. Obesity is one of the leading causes of sleep apnea, and in the States, about a quarter of the population between 30 and 70 years of age suffer from sleep apnea. So we see, these quite unfortunate tailwinds from growth in chronic illnesses and particular applications that companies have that create those tailwinds. So Blair, sorry mate, I'll leave it to you.
Yeah, no, certainly becoming big business, Cam. But just looking at the fundamental drivers of value in the space, perhaps a question for you: how do the companies actually solve the issues in healthcare and profit from solving these issues?
Yeah, look, I mean, this is sort of interesting, is to think about, the fact that we're trying to lower cost, but how do you do that in a way and still maintain profits? And there are really what we sort of see as three fundamental drivers in terms of, ways that you can add value to the system. The first, broadly speaking, is to enable the scalability of doctors or healthcare providers. Doctors are a precious resource, enabling them to provide services outside of a hospital environment or a clinic environment. That's key. Second is better health outcomes, and obviously that's good for the population, but it also means less repeat treatments. And the final one is just to lower cost, right? So if you can provide, any one of these and do it in a manner that allows you then to generate profits, is a very strong business case for so that sort of, technologically enabled solution. We talked about a few of these names here. Other ones mentioned on this screen are Amwell, which is a telehealth service, and then Accolade, that provides customer-centric tools to help you understand your insurance policies and your workplace benefits within healthcare. So all really designed around providing particular benefits to the system as a whole, and all with strong cases for generating sustainable profits. So yeah, I mean, Blair, this is sort of interesting. We did talk a bit about about whether or not telehealth was something that was a bit of a COVID fad when we were looking to launch this index. And we were deliberately late in terms of launching this ETF because we wanted to see how the trends in adoption of telehealth would play out. Do you want to talk a bit to that? And also just talk about, not necessarily the future, but just today, like where could we see shifts today from higher cost inpatient care to digitization of healthcare?
Yeah, it's a really interesting point, Cam. I mean, the left-hand side of the screen is important. I think there's no doubt. We're all aware that telehealth surged during the initial stage of the COVID crisis, so March 2020, and it's definitely left us with ways to operate going forward in a non-pandemic environment. But if we fast forward from 2020 to 2021, it was interesting to see that telehealth utilization remained at 38 times the pre-COVID baseline after peaking in that initial stage of the virus, April 2020. But also interestingly, 58% of physicians viewed telehealth more favorably than before COVID. So where does that leave us now? We looked at a study from McKinsey and Company, which identified 20% of US outpatient healthcare, which could be converted into digital. And if you shift your gaze to the right part of your screen there, these models of virtual care have increasing requirements to engage broader and broader portions of the healthcare delivery system. So going from offering one-off urgent visits to building multi-channel care models that deliver a large portion of medical office visits virtually, or near virtually, to embedding these services in home care outcomes. So on-demand virtual care is an alternative to lower acuity emergency department visits, urgent care visits, and after-hours consultations. These care needs are the most common telehealth care uses today, and it allows the consumer to remotely consult on demand with an unknown provider to address immediate concerns. So it could be an acute sinus infection, but avoiding a trip to the emergency department. Moving on, you've got virtual office visits with an established provider for consults that don't require any physical exams or concurrent procedures. So such visits can be primary care, so a chronic condition check, a cold, a minor skin condition. It could be behavioural health, so a virtual psychotherapy session, or it could be some more specialty care like rehab post a heart issue. So the model also enables clinicians to better manage patients with chronic conditions. And then the final one there, tech-enabled home medication, allowing patients to shift to receiving some injectable drugs from the clinic to the home. And that shift can happen by leveraging remote monitoring to help manage patients and monitor symptoms, providing self-service tools for patient education. So for example, they're training for self-administration. So there's three aspects which could immediately be considered.
Yeah, and Blair, just to touch on one of them, the virtual visit, if you like. I mean, one area which we've seen a large growth need is in mental health, and it's an area which very much lends itself to a virtual service. Generally speaking, we're not talking about a physical exam requirement. Often people that suffer from mental illness are reluctant to visit in person. So that has been an area where a number of those providers we talked to before are providing new platforms and new ways of servicing people who suffer from that illness. So that's just interesting to look at the mix of healthcare there.
Absolutely. Now, Cam, that comes to the end of the formal presentation, and we're right on 20 minutes, which is good. We've kept to time. Couple of things to keep in mind. Obviously, we will make this presentation available to everyone that's attended today. It's important to consider the risks. So I just wanted to highlight this slide. Please read through it. And now I just wanted to shift more to questions that are coming through. And I know I'm just looking that there's a couple coming through here. But Cam, maybe just one of the first ones to kick off. Market volatility's picked up this year, and growth stocks in particular have been hit. Do you have any comment on this impacting the fund or just funds in the growth space in general?
Yeah, look, I mean, it's good point. So what we had seen since for example, when the US Fed pivoted to a more hawkish stance, and we're driven obviously by the pickup of inflation and seemingly more embedded inflation, has been that bond yields have increased, and this impacts the valuations that are ascribed to equities. So when bonds have higher yields, typically people are willing to pay as much for equities, and this particularly impacts growth equities, those that have very strong earnings profiles into the future. And so the valuations ascribed to these companies have fallen, and there's been a lot of volatility in markets. What I would say is that what we think about with thematic exposures is, our view is we like to try to form conviction around a structural trend. And in our view, we think there is a long-term shift that's going to be required to digital healthcare. We think that's going to play out over decades. To exploit such an opportunity, in our mind, you're best placed to invest with a very long-term time horizon, because we can see volatility in the short term. But the importance here is to form a view that you have high conviction around the earnings and the revenue profiles and the underlying themes there that these companies are leveraged to, and invest over that longer term time frame across the cycle, because we'll obviously see ebbs and flows in consumer sentiment and the like. With regard to, so I mean, there's just a question here about, where do we, why do we think that digital healthcare will in fact be something, telehealth, for example, grow? And just to sort of frame this, perhaps, Blair, I mean, we talk a bit about the underlying mega trends that really, drive this thematic, being demographics and being technology. Do you want to touch a bit on that?
Yeah, absolutely, Cam. And look, just to be clear, if anyone needs to leave, the recording will have the question and answer session. So please feel free if you are running out of time. But Cam, look, good question, and you're right. We've sort of identified in the market three key mega trends, one being technology and the other two being demographics and climate change. I think in particular to this ETF exposure, demographics and technology are quite important. So as a species, humans are aging, global population aged 60 and over more than doubled between 1980 and 2017, and it's expected to double again by 2050, reaching around 2.1 billion. So aging populations around the world, coupled with slowing population growth rates in many large economies, will reduce the supply of labour, eroding government tax bases, and so on and so forth. So we certainly feel that, in this thematic, digital health sits in between demographics and technology, and is really picking up on the fact that we are getting older and we need to embrace technology to address some of the issues that come with that, and certainly just make our lives easier by being able to interact with personal care or doctors in a less formal setting, but still getting that quality of care.
Great, thanks, Blair. There's a couple of questions here just asking about performance. So look, I just quickly looking that up. The performance of EDOC since inception, so this is only a very recent fund, it's been around for a few months, it's fallen by 11% from inception to the end of April, which is probably a little bit more than markets have fallen. I mentioned that growth exposures have fallen. This would be considered in that category. I don't necessarily suggest that we would expect that EDOC would provide positive performance over any particular period, particularly short-term periods. Our view is that this is an opportunity to invest in a longer-term trend. So a performance period of 2 months, I don't necessarily think is indicative as to what you might expect, or you can't necessarily extrapolate that out over 10 years, for example. Also, just another question here about our thematic funds, and what is the overlap with this fund versus other funds that we offer? Blair, I'm not sure if you've got the data, but can you talk to that generally?
Yeah, I don't have the data on me, but just from memory and I know you've done a little bit of work with this as well, just in terms of the fact that we've released quite a few thematic funds recently. What's the crossover? And I know EDOC came up that it had the least crossover in companies of the other funds. And that's really a proof point for diversification, or a satellite holding for trying to generate extra alpha. So we've done that analysis, and what you're getting is a satellite exposure that doesn't overlap potentially with your core holdings, which I think in terms of correlation and things in portfolio construction can be really important.
Yep, great. Okay, Blair, if we got, there's one last question. I wouldn't mind answering this one if that's okay. And there's just that someone's asked about the concerns around, you Blair talked a bit about the need to have real-time data available to patients, and asking a bit about privacy issues around the sharing of data. And look, this will be a challenge within the digital healthcare space, but fundamentally we have a challenge that just needs to be solved. There's no two ways around it. You can kick the can down the road, but we have a serious funding issue in healthcare, and we have serious health outcome issue. And so while this is a challenge that regulators and the companies have got to get their heads around in terms of how data is managed, the advantages we get from securing data, from sharing data in a very secure manner, undoubtedly can help both in terms of cost and outcomes. So in my mind, it's kind of a non-negotiable that we're going to need to be more comfortable with sharing health data in a secure manner, because the upside is so great and the cost of not doing so is so high.
Absolutely. Look, Cam, I think that's all we've got time for. There are a couple of questions we haven't got to, but we'll happily address them with the relevant asker after the session. Thank you very much for your time today, and thank you everyone else for joining today. We hope that you've got something out of the session. Once again, we are holding our final webinar for the thematic series next week on game, esports, and online gaming. So we'd love you to attend that. But in the meantime, thank you very much for attending, and enjoy your day.
Thank you.